Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing again a small topic in inflammation, that is vascular events in inflammation. So see, vascular events जो होता है, this is the earliest response to any kind of insult the tissue is facing, any kind of injury. So ultimately क्या होगा उसके बाद एक tissue injure हुआ तो after injury it will show alteration in the microvasculature. So there will be certain changes in the arterioles, capillaries and venules में. Fine. So these alteration जो capillaries, venules और इन सब में होंगे वो होंगे hemodynamic changes और altered vascular permeability. Fine. So first we'll be dealing with hemodynamic change, उसके बाद हम altered vascular permeability देखेंगे. So this is the earliest feature of inflammatory response, that is hemodynamic changes. How it occurs? This is due to the change in any vascular flow or caliber of small blood vessels in the injured tissue. So thereafter, in this under hemodynamic changes, you have certain sequence of changes होते हैं, ठीक है? So वो changes क्या क्या होंगे? First injury हुई तो क्या होगा? जो vessels हैं, arterioles में there will be a transient vasoconstriction. Transient means is for a very short period, the arterioles will undergo vasoconstriction. उसके बाद second step में it will be persistent progressive vasodilatation. ठीक है? Then third step is increase in local hydrostatic pressure. We'll see one by one. Then after there is increase in the local hydrostatic pressure, there is slowing or stasis you can say of microcirculation. So obviously जब normal blood flow में alteration आएगी तो क्या होगा? Blood viscosity increase हो जाएगी, ठीक है? And then fifth is the leukocyte. उसके बाद leukocyte जो polymorpho-neutrophils हैं वो सारे PMNs that is the we call as polymorphs. So वो migrate करके या फिर और there will be a peripheral orientation of leukocyte, which means जो polymorphs हैं वो vessels के lining पे मतलब peripheral हो जाएंगे. From the center of the vessel it will go to the periphery. So coming to the first change, the hemodynamic change क्या हो रहा है? That is immediate vascular response is transient vasoconstriction of arterioles after any type of cell injury. अगर mild injury है तो blood flow जो होगा that will be re-established within 3 to 5 seconds. But in case the injury is severe, the vasoconstriction may last for 5 minutes also. So this is the first step, transient vasoconstriction for brief period, following which we have persistent progressive vasodilatation. That is, this will involve mainly the arterioles, but venules और capillaries भी involve होते हैं. And this occurs, जैसे वो हमारा immediate response था, vasoconstriction, transient vasoconstriction. Within 30 minutes of injury, there will be persistent progressive vasodilatation. So इससे क्या होता है इसमें? Increased blood volume in microvascular bed of the area, and this way बहुत blood volume बढ़ रहा है उस area में जहाँ injury हुई है. So there will be increase in redness and warmth at the site of acute inflammation. Temperature raise होगा if you touch that area. So after progressive the vasodilatation, what you see the change is that the skin around that injury will be red, and you can have like you can check it with your back of your palm. There will be increase in warmth. So area becomes more warmer as compared to your normal skin temperature. So these are basically a sign of acute inflammation. So now we are done with two steps. First was transient vasoconstriction followed by persistent progressive vasodilatation. Third comes increase in local hydrostatic pressure. So now the increased blood volume to that area, what it will do? So blood volume is increased, so it will in turn elevate the hydrostatic pressure. So that once the hydrostatic pressure is increased, so that will result in transudation of fluid into the extracellular space. So fluid will leak out into extracellular space. So this is responsible. So now when fluid is out into the extracellular space, so that will be responsible for swelling at the local site of acute inflammation. Then finally, stasis of microcirculation. Now there will be increase in concentration of the red cells leading to increase in viscosity of blood. Then finally, what happens? There is leukocytic margination, peripheral orientation. जो endothelial lining होती है, एक जब आप blood vessel देखते हो, you have a lumen and then you have endothelial lining. So these leukocytes or the polymorphs will lie down it will orient itself peripherally around the endothelial lining. It will stick to the vascular endothelium for a moment and then it will move and migrate through the gaps between the endothelial cells in extravascular space. Fine. So that will also leak out. उससे क्या हो जाएगा? इन्फ्लेमेशन बढ़ेगी उस फ्लूइड में, ठीक है. सो इडीमा पहले फ्लूइड लीक आउट हुआ था, देन धीरे धीरे पॉलीमर्स आल्सो गोस इनटू द एक्स्ट्रावैस्कुलर स्पेस. सो नाउ ट्रिपल रिस्पॉन्स क्या होता है, विच इज इलस्ट्रेटेड बाय योर लीवीस एक्सपेरिमेंट कहते हैं इसको, ठीक है, लीवी एक्सपेरिमेंट. सो दिस experiment will describe the feature of hemodynamic changes which is occurring in inflammation. So what did you do it? The inner arm of your forearm जो होता है ना, inner aspect of your forearm, you stroke it with the firm blunt point and then you observe the changes. ऐसे करके फट से एक blunt stroke करोगे आप, stroke करोगे firmly with a blunt point object and you see the changes. Fine. So the reaction which will be elicited in your skin area, so that is known as triple response or red line response. So triple line or red line response is what? So you get three things: red line, flare and wheal. क्या होता है ये? Red line appears within a few seconds after the stroke is put. So that is because of local vasodilatation of capillaries and venules which is occurring. Then flare is what? It's a bright reddish appearance or flush. जहाँ red line stroke की होगी उसके surrounding में bright reddish appearance आएगा, hue or flush you can say. That is because of vasodilatation of adjacent arterioles. And third, you get wheal, that is swelling or edema of the surrounding skin. So that is because of transudation of the fluid into the extravascular space. 5 points जो हमने पढ़े थे वो, ठीक है. So you can say as a whole ये triple line और red line response देता है. So these three responses, so these elicit the classical signs of inflammation: redness, heat, swelling and pain, which is due to the mild trauma to cutaneous nerve endings. So we are done with the hemodynamic changes. अब हम discuss करते हैं altered vascular permeability. ये है, and this is resulting in accumulation of edema fluid in interstitial compartment in and around the inflamed tissue. ये कैसे होता है? This comes from the blood plasma. जो हमने पढ़ा कि blood plasma जो है by its escape from the through the endothelial wall, जो हमने जो अब leak out करना शुरू हो जाता है जहाँ fluid बाहर आ रही है. So this edema fluid is getting accumulated in the interstitial compartment in and around the inflamed tissue, and this blood plasma is coming out through the endothelial wall of vascular bed. So initially क्या होगा? Escape of fluid जो होता है, that is because of vasodilatation and in consequent increase in volume of the blood, which is causing your local increase in hydrostatic pressure. उसकी वजह से fluid बाहर आ रहा है, ठीक है. जो वो fluid बाहर गया ना, that is transudative in nature. ये हमने subsequent lectures में देखेंगे what is transudative, what is exudative fluid, ठीक है. So gradually जब plain fluid बाहर आया, so उसके बाद क्या होता है? Characteristic inflammatory edema or exudate appears. Inflammatory edema because now inflammatory cells जैसे polymorphs हमने पढ़े थे वो भी extravascular space में इकट्ठा होना शुरू हो जाते हैं. Fine. So that is inflammatory edema. So appearance of inflammatory edema is due to what we had read, increase in vascular permeability of the microvascular bed, and this you can explain by Starling hypothesis. According to this, जो normal fluid balance होता है, it is maintained by basically two opposing set of forces. एक force वो होती है जो outward movement of fluid कराती है from microcirculation. वो होता है हमारा intravascular hydrostatic pressure and colloid osmotic pressure of interstitial fluid. Fine. So और जो force which causes inward movement of interstitial fluid into circulation, so that is your intravascular colloid osmotic pressure and hydrostatic pressure of interstitial fluid. So these two set of forces keep on fighting with each other to maintain the balance कि वो normal condition में कैसा रहेगा, inflammatory condition में कैसा रहेगा, ठीक है. So even the little amount of fluid जो left out रह जाता है, that is drained out by lymphatic. तो extravascular space में edema नहीं होनी चाहिए in normal cases. But inflammation में क्या होता है? Endothelial lining of जो microvascular structure है वो leak हो जाती है. Fine. So क्या होगा? जो intravascular colloid osmotic pressure है वो decrease हो जाएगा. Osmotic pressure of interstitial fluid will increase. So that will result in excessive outward flow of fluid into the interstitial compartment. Now, and additionally to that, polymorphs भी बाहर जाएंगे, so you have an exudative inflammatory edema. See this picture. ठीक है? ये लेफ्ट साइड जो विच आई एम शोइंग यू, दिस इज द नॉर्मल फ्लूइड एक्सचेंज. ठीक है, ये अगर सपोज आपका वेसल है, दिस होल इज योर वेसल, फाइन. दिस इज द आर्टेरियोलर एंड, दिस इज द वेन्युलर एंड. ठीक है, हाइड्रोस्टेटिक प्रेशर, ऑस्मोटिक प्रेशर, दोनों हाइड्रोस्टेटिक प्रेशर, ऑस्मोटिक प्रेशर हम देखते हैं ना, वो दोनों प्रेशर इज इंपॉर्टेंट. एक इंट्रावैस्कुलर होता है यहाँ अंदर का जो होगा, और यही दोनों प्रेशर हमारे एक्स्ट्रावैस्कुलर कंपार्टमेंट के लिए भी इंपॉर्टेंट है. ठीक है, और ये टिश्यू है, टिश्यू टेंशन. सो दिस इज आउटसाइड. सो दिस वेसल से जब कोई लीक आउट होगा तो ये स्पेस में आएगा. सो दिस इज योर एक्स्ट्रावैस्कुलर स्पेस, फाइन. सो यहाँ क्या हो रहा है, और जो भी थोड़ी बहुत फ्लूइड बचती है यहाँ पे एनीवेयर, सो इन नॉर्मल कंडीशन दैट इज ड्रेन्ड आउट बाय लिम्फेटिक चैनल्स, फाइन. सो नाउ व्हाट हैपेंस, राइट साइड यू सी व्हाट हैपेंस इन एडिमा. इसमें क्या होता है, जो इंट्रावैस्कुलर ऑस्मोटिक प्रेशर है अंदर, वेसल के अंदर का ऑस्मोटिक प्रेशर इज डिक्रीजिंग, फाइन, और बाहर का ऑस्मोटिक प्रेशर इज इंक्रीजिंग. तो ये क्या हो रहा है, ऑस्मोटिक प्रेशर अंदर घट रहा है. ठीक है, तो ये बाहर आ जाएगी फ्लूइड. ठीक है, सो दिस फ्लूइड विल एक्यूमुलेट इन योर एक्स्ट्रावैस्कुलर स्पेसेस, फाइन. तो ये अब एडिमा इन सब एरिया में फ्लूइड एक्यूमुलेट होना शुरू हो जाता है. So when there is decrease in osmotic pressure of the intravascular structure, so that will leak out, fluid आएगा बाहर extravascular space में, and then it gets deposited in the extravascular space resulting in edema. So various mechanisms जो होते हैं, जो इंट्रावास्कुलर परमेबिलिटी होती है ना वेसल्स की, उसमें बहुत सारे mechanisms होते हैं. वो या तो सिंगली एक्ट करते हैं या वो इन कॉम्बिनेशन एक्ट करते हैं. So that explains you how a non-permeable endothelial layer of microvessel becomes leaky. Leaky कैसे होते हैं, और from increased vascular permeability in acute inflammation. Fine. So these कुछ mechanisms हैं जिसकी वजह से vascular permeability बढ़ती है. वो permeability बढ़ेगी तभी तो mechanism क्या अंदर क्या changes हो रहे हैं जिसकी वजह से vascular permeability बढ़ रही है. एक होता है endothelial cell contraction. Fine. Second is contraction or mild endothelial cell injury. Third is your direct endothelial cell injury. Then you have leukocyte mediated endothelial injury, transcytosis and neovascularization. So ये picture देखो, ये अंदर एक vessel है, ठीक है. So these are your endothelial cells. So this is the endothelial lining, और ये हमारे endothelial cells हैं, और ये दो हमारे polymorphs हैं यहाँ है made. फाइन. तो और ये हमारा बेसमेंट मेम्ब्रेन होता है, तो थिक आउटलाइन यू आर सीइंग. सो ये बेसमेंट मेम्ब्रेन, ये एंडोथेलियल सेल्स, ये ओवरऑल होगी एंडोथेलियल लाइनिंग, ये दो एंडोथेलियल लाइनिंग, और ये हो गया ल्यूमन ऑफ द वेसल. ये है वेन्युलर एंड, ये है आर्टेरियोलर एंड. तो हमने देखा ना मैकेनिज्म में हमें पढ़ा 6 चीजें कि ठीक है. तो हमने मैकेनिज्म पढ़ा कि एंडोथेलियल में क्या चेंजेस, एंडोथेलियल लाइनिंग में क्या चेंजेस आ सकते हैं, और कुछ और चेंजेस जो अकेले या फिर they act in combination to cause increased vascular permeability. Fine. So first is contracted endothelial cells. Endothelial cell itself can get contracted. Second is contraction or mild endothelial damage. कुछ damage हो सकते हैं endothelial cells में. Then thirdly, you can have direct injury to the endothelial lining, तो उससे भी vascular permeability increase हो जाएगी. Then you have endothelial injury by polymorphs. तो ये polymorphs भी extravascular space में जाएंगे बाहर injury होके, ठीक है. Then you can have transcytosis that I'll tell you in next class. कि हम उसको पढ़ेंगे क्या होता है. So when we read the cellular events, then I'll tell you in detail. Then you can have neovascularization की वजह से भी इंजरी होती है, जो new blood vessels form होना शुरू होते हैं. Fine. So these all are changes which causes increased vascular permeability in acute inflammation. So today we have done the vascular events of acute inflammation. Fine. In inflammation. So next lecture I'll deal with cellular events in inflammation. And also we can deal with some mediators of acute inflammation. So thank you so much for your patient hearing. Please like, subscribe and share my channel. Thank you so much. Stay calm, love pathology.